BI-RADS 3, probably benign. In most cases, it's not cancer. One of the first questions patients ask is, what does BI-RADS 3 mean on mammogram or ultrasound report? Is BI-RADS 3 breast cancer? Here's the simple answer. BI-RADS 3 means the finding looks probably benign, in other words, highly likely not cancer, but it needs a short period of follow-up imaging to confirm it stays stable over time. By definition, BI-RADS 3 means the chance of cancer is greater than 0, but less than 2%. That's why the plan is close monitoring, not panic. Here's an important trust point many people don't hear clearly. BI-RADS 3 is usually assigned after the diagnostic evaluation is complete. That often means extra mammogram views, and sometimes a targeted ultrasound were already done to confirm there are no suspicious features hiding in the details. The process can feel slow, but it's thorough, and that's a good thing. At this point, many patients wonder, how worried should I be about BI-RADS 3? The honest answer is this: worried enough to follow the plan, but not so worried, because this type of finding is overwhelmingly benign. Now let's talk about why this score is given. After diagnostic workup, BI-RADS 3 usually fits a few classic patterns. One example is a well-defined round or oval solid mass, often something that looks like a fibroadenoma. Another is a focal asymmetry that has been carefully checked on extra views and does not show concerning distortion. A third example is a small solitary group of round or punctate calcifications that look very likely benign on magnified images. When BI-RADS 3 is assigned on ultrasound, the meaning is the same. BI-RADS 3 breast ultrasound, probably benign explained, a very low-risk appearance that is confirmed through stability over time. Another important factor is breast density and BI-RADS 3 classification. Dense breast tissue can limit mammogram detail and sometimes requires ultrasound for clearer assessment, especially to confirm a finding is truly well-defined and low risk. Now let's move to the part that makes most people anxious: the timing. The 6-month follow-up for breast mass protocol often raises concern. So why 6 months? Because the goal isn't to wait blindly. The goal is to check early enough to catch any meaningful change. Because a small number of cancers can initially look probably benign. That's exactly why BI-RADS 3 exists. It helps avoid unnecessary biopsy for the vast majority, while still detecting change early for the rare exceptions. The standard approach is the BI-RADS 3 follow-up schedule: 6 months, 12 months, and 24 months. The exact timing can vary depending on the imaging center and whether the finding was seen best on mammogram or ultrasound, but the structure is consistent. Follow-up at around 6 months, again at about 12 months. And then a final confirmation around 24 months. And this is the key idea, why 2 years of stability matters for BI-RADS 3. Because stability over time is essentially the proof test. If the finding stays unchanged through the follow-up window, it becomes part of a benign baseline, and routine screening usually resumes. Now, what exactly is being checked at follow-up? The focus is on any change. That makes the finding less likely to be benign, especially meaningful growth, a change in borders or margins, or a change in the calcification pattern. Some teams use a practical ultrasound benchmark, like around a 20% increase in size, as a growth flag. But the bigger principle is this: any convincing change in shape or margins matters more than a single number. If the finding is stable at early follow-up, the risk drops further. If it remains stable across the full period, that's why it's treated as benign moving forward. This often leads to comparison. BI-RADS 3 versus 4. Why I don't need a biopsy yet. Here's the difference. BI-RADS 4 means the finding is suspicious enough that tissue sampling is recommended. BI-RADS 3 means the imaging features are so likely benign that it's considered safer and smarter to monitor, because most biopsies in this group would turn out to be unnecessary. This brings up an important question. When a probably benign finding needs a biopsy is usually recommended if the finding changes on follow-up imaging, develops suspicious features, or the clinical situation doesn't match the imaging. This last point is extremely important for safety. It's called clinical imaging discordance. For example, if there is a new persistent lump that can be felt, especially if it feels hard or fixed, that deserves medical attention, even if the imaging looked probably benign, earlier evaluation may be needed, because the full picture matters, not the image alone. Another situation is when follow-up imaging isn't reliable. If returning for scheduled imaging isn't possible, biopsy may be chosen sooner to be safe. And yes, anxiety matters too. Some people feel a biopsy will reduce stress, but it can also create its own stress, worry about the procedure, and the wait for pathology results. In many BI-RADS 3 situations, the follow-up plan is actually the calmer, more structured path. A second opinion is also completely reasonable. Probably benign can still feel emotionally heavy, and clarity helps. Now let's finish with real-world next steps. Many BI-RADS 3 findings are not palpable. But if a new lump develops, or there is skin dimpling, nipple retraction, or concerning discharge, notify a doctor. Don't ignore your body just because the report says BI-RADS 3. If there is a family history of breast cancer, BI-RADS 3 can still be appropriate, but overall risk can affect how quickly a biopsy is recommended or how closely follow-up is planned. Finally, please don't miss follow-up appointments. If a 6-month appointment is missed, don't panic. Just rebook as soon as possible. The value of BI-RADS 3 depends on completing the stability checks. If this was helpful, please subscribe to Dr. RRJ Health. These videos are made to help patients understand your breast imaging report, BI-RADS categories, clearly without fear, so the next right step feels easier. See you in the next one. Stay subscribed.